Good morning, everyone. I'm going to present our individual transition plan, which is essential to ensure the successful transition from school to community living for young adults with special needs who require additional agency supports after leaving school. The identifying data is our student, whose name is Dave, is a male and currently 7 years old. In school, he is in a non-graded classroom, but at the height of the pandemic, he is currently in a parental home study. Support services is His support services are Dr. Cristal M. Escusa and occupational therapist Emma Punsalan. Dave's general health is average. Aside from his diagnosis, he does not endure other medical conditions. He do not have a physical disability, and while in communication, he does have a speech delay according to his doctor. Fortunately, Dave does not have any visual or hearing impairment. Since he does not have any other health issues, he does not take any critical medication. Most recent assessments, Dave did occupational therapy on August 13, 2019 with Emma Punsalan, who's an occupational therapist. It was recommended that Dave's other needs should be addressed by a speech pathologist and educator. Academics assessment on school year 2020 to 2021 by Ms. Christine Joy G. Nibres. He is retained in non-graded resource class. Life skills performance profile. Dave's main form of communication is verbal, but he indeed has a bit of speech delay. His behavioral considerations are that sometimes he does not respond to being called to do something. His interaction skills need improvement because sometimes he has a tendency to be aggressive towards other children. When it comes to personal care, he is semi independent and can get himself ready for dressing up or putting on shoes. He can also clean up after himself. He knows how to put out used plates and bring them to the sink. He still needs assistance with his community functioning skills, and this is also due to the current pandemic. His only community access is school, and the mode of transportation is by car. Dave is still trying to learn how to write, but his dominant hand is his right hand. Adaptations. We chose these adaptations to ensure that he can learn adequately and comfortable at the same time to make illicit and skills behavior for a smooth transition. Environmental adaptations is are reducing distraction, provide quiet corner rooms, assistance in maintaining uncluttered space, and space for movement or breaks. Instructional adaptations make one on one resource instructions, take note, outlines, study guides, and vary method or content of instruction, modify workload length time, alternative assignments, and answers can be dictated. Also, extra visual or verbal cues and prompts, hands on activities, books on tapes, a use of manipulatives, textbook for at home use, and the likes. Social or behavioral adaptations is to allow him frequent rest breaks, additional time, rest test to student, oral testing format, alter test types like multiple choice or essay types or true or false, and provide study guide prior to the test. Also, lastly, highlight key directions. Since Dave is diagnosed with autism spectrum disorder, these adaptations are made in order to ensure again that his learning environment will be conducive, the instructional materials will cater to his needs, and the social and behavioral aspect of his learning can be focused on since he still needs assistance with these ones as well. Roles and responsibilities for the team members or of the team members. There are many people involved in Dave's transitional plan. First off, of course, Dave, the student, is involved, classroom teacher, counselor or case manager, and his parents. His parents' roles is to support the ITP design for Dave, and the vocational counselor assists in exploring vocational goals based on his interests, abilities, and skills. While classroom teacher provides adaptations to the educational programming in accordance with the IEP. Lastly, again, it will be Dave who will follow the rules and routines directed to him by him and complete all tasks assigned. Student specific programming. Dave has an individualized program, and the domains that we are going to focus on are there are three. The first one being fine motor skill and current level of performance is needs improvement. The student outcome would be the child should be able to write letters and his name independently. Our assessment for this is the child will be given a tracing worksheets to assess his legibility of his writing. The teacher will provide uppercase and lowercase letters in tracing worksheets for the child to practice. The next domain is vocational skills and current level of performance is satisfactory. His vocational preferences is because this family has a sari-sari store, which we can conclude that it is a type of work where he wants to do. He helps in the family business by arranging products in the rack, giving changes to customers, and returning the extra products. Last domain is answer basic social questions appropriately. And his current level of performance is needs improvement. We can enforce help to Dave by using methods such as peer buddies, engage in communicating with family and friends, and have them join a class or group where children of the same age meet consistently and frequently. The teacher will expose the child to his classmates during group works and during playtime. The teacher and parents will ask the child social or basic social questions every day and prompt responses. All right, thank you so much for listening, everyone, and that will be it for our individual transition plan.